What can you use to treat spinal stenosis? So let's say the diagnosis comes back as, hey, you have stenosis. What does that even mean? So a spinal stenosis just means that a hole or any area where a nerve root is moving through that hole has become decreased. It just means that the hole has lost some space. The first question is, so it's there, right? We can say that safely that the scan has identified it, but the question is it actually affecting that nerve root? Is it the cause or the source of the pain? So a stenosis can be actually bony, where the bone itself is smaller. That hole is now smaller. But there are still times when that hole, or when the nerve has enough space. The other thing that could be happening with a stenosis is that the hole is normal size, the nerve root's going through, but now a piece of disc tissue, a soft tissue, is occupying some of that space within the hole. And now there's not enough space because of the soft tissue moving into space it doesn't belong in. So the question of, well, what should I do for spinal stenosis? There's a lot of things you could do. It depends on what's causing it. So first we have to identify the right structure. And we don't need special tests to identify the right structure. What we need is to take a good history. So you've got to ask yourself, what do I feel better and worse with? Would I rather be like up, moving around, staying active, and I don't like being like seated or bending forward? Okay, likely a soft tissue disc issue. And then there are specific movements and loads that we can use to change that. The opposite could be true as well. No, I could sit forever. I could sit, I'm the person that when I'm pushing the shopping cart, I'm bent over on the shopping cart because I do not like being standing and walking. It might be very consistent where I can only walk, 5 blocks and then I have pain down my leg. And as soon as I sit, it goes away. Now that could be more of a true like bony stenosis. So those are treated completely differently. But you still have to assess it because some will respond to specific movements into a direction like flexion. Some will respond to a specific movement into extension. Some will respond to a specific movement into a lateral side glide. It just depends. Nothing is universal when it comes to spine, disc, that kind of like mechanical joint pain in the spine. There's nothing universal that says, well, because you have been identified as having a stenosis, you have to do X or Y. No, everyone's individual, and you still have to assess it thoroughly to first even know, like we said in the beginning, to first even know if the stenosis is even the problem. It may not be, and let's just say it is, then is it more soft where you can move it, or is it more hard and bony where you can't move it?